subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors Today. We are delighted to have here with us Dr. Anitha Kamarthy, who is a senior cataract and glaucoma surgeon. And this time, as we keep trying to move away from Mumbai, where we've had most of our doctors, so we are connected to Hyderabad, where Dr. Kamarthy is a senior cataract and glaucoma consultant at the Maxivision Super Speciality Eye Hospital in Hyderabad. Before I invite her to speak, I must mention that she is an MBBS and an MS in ophthalmology from Osmania Medical College. She has done her training from the famed Shankar Netralaya, and now she has been working with the Maxivision chain of hospitals, which are in Telangana, Andhra Pradesh, and expanding further. Thank you for being here at the health webinar. So the session, folks, that we are having today is on glaucoma.
What is glaucoma? Glaucoma is a group of eye diseases that damage the optic nerve, and it is usually because of high eye pressure. Basically, we have three types of glaucoma, that is open angle glaucoma, angle closure glaucoma, and normal tension glaucoma. Why is it important? Is because it is one of the leading cause for blindness, and also if left untreated, it can lead to visual debility. The risk factors for glaucoma are age. If you're above 60, then definitely you are at risk. If you're 59, please continue to enjoy for some more time. Family history, yes, it is a family gift that you really inherit, because the normal risk for normal people is around 16%, while that for if you have a family history, it goes up to 30%. And coming to the ethnic background, Americans, Africans, Hispanics, and Asians are at risk. The only people who are protected are maybe right now the Europeans. Medical conditions like diabetes mellitus, hypertension, and eye trauma. Eye trauma, they increase the risk of glaucoma. If you have a long-term steroid use, you have to always consider getting yourself checked for glaucoma. Coming to the symptoms of glaucoma in early stages, often it is asymptomatic. So it is like the sneaky thief who steals your vision. So, and the possible symptoms that one can experience are blurred visions, halos around the lights, loss of peripheral vision. It takes a very important, intelligent person to know that they have a peripheral loss of vision. And the initial loss, nobody really gets it. It's only in the final stage that people realize that they have lost vision. And when they come, it's like end stage. Diagnosing glaucoma, it's very important. It's that we catch it early, so that if the treatment started early, none of the people can lose vision. That is our lifelong fight with everything is. So what we need for that is regular eye exams by ophthalmologist and not by an optometrist. And common tests that we perform when you come are like tonometry, that is to measure the pressure within the eye, fundoscopy to know how the nerve is, visual field tests, and glaucoma optical coherence tomography are done if we suspect anything on fundoscopy. Coming to the treatment options, they vary. Initially, we start with medications, usually the eye drops. They work wonders, they lower the pressures, but only adherence to the treatment is what is required. We give oral medication only when the pressures are very high and we cannot know how it is. Laser treatment includes peripheral iridotomy, laser trabeculoplasty, and then we have laser transscleral cyclophotocoagulation. These are less invasive, They do work well, but depends from patient to patient. You cannot do these procedures in all of them. Surgeries, the latest are the microinvasive glaucoma surgeries, which have come out in the recent 10 years. These are microinvasive, least problem causing. They do reduce the pressure to a good level. Then you have the age-old surgery, which were done from a long time, like trabeculectomy and tube procedures. The challenges with the treatment is basically the adherence, because most of the patients are on multiple drops. Sticking to them, using them on time, which is required, is a little a problem. And to add it to that, you have the forgetfulness in taking medications. There is a possible side effects from treatment, because few drops can cause redness, irritation, itching, and all that. Then there is confusion with multiple medications. You are given 10 drops and then all of them have to be administered. Sometimes patients do get confused. So the solutions for that is using reminders, or you can keep an alarm in the smartphone, or using a pill organizer or a calendar where you can just tick off, okay, have used this drop at such and such a time, and then have repeated papers like this to identify. Having family or caregivers assist with medications is another thing, especially for the elderly. Lifestyle changes to support eye health, especially you need regular yearly eye checkups. Once you are above 60, you have to maintain a healthy diet. Exercise is a must. And yoga and meditation have been found to be very helpful, especially in glaucoma patients. To summarize, glaucoma is a serious condition causing irreparable vision loss. Being aware of risk factors can help in early detection. Consistent treatment and lifestyle choices are crucial for managing glaucoma. And that is the small presentation I had put together. Sorry, I'm unable to share the photos and all, which help in understanding better.
Yeah, all right. What we'll do is we will, for the benefit of everybody here, we will have the presentation on our website on Monday when we have the edited video from here. In the meantime, some questions have already come in, and I'm going to make address the questions to you. You have already made a mention of this, but what are the dietary? Can you talk a little about the dietary management? Akanksha Saxena asks.
Dietary management, I would say, because diabetes and all hypertension are also a risk factor. Taking a healthy diet is always beneficial, like including a lot of green leafy vegetables, carrots in your diet, eating regularly, all that helps.
Right. There's a question which is from Jaya Prasad. When you get your cataract done, during the testing, then can glaucoma also be tested? Be deducted?
Yeah.
Rather, be deducted.
Whenever we are doing the cataract procedure, we always have the tonometry done, where we check the pressures in the eye. We examine the retina and the optic nerve. We check if the patient has narrow angles or not. We try to rule out if the patient has glaucoma or not, then go ahead with the cataract surgery. Nowadays, if we think that, yes, patient has glaucoma, raised pressures, and a cataract, what we can do is we can club the cataract surgery along with the microinvasive glaucoma surgery, where the pressures and also the cataract is taken care of, and the patient also can be medication free, which how everybody prefers being not using medications daily.
Right. There's a question from Mr. Anil Singh, who says, my cousin had glaucoma at the age of 58 and lost his vision. Can that be treated as a family history, or I have more risk of glaucoma?
I would suggest a younger patient developing glaucoma is more genetic rather than an older patient developing glaucoma. So I would suggest yes, it is a family history risk factor. It's always better if you have a younger age group person who has developed glaucoma to get your eyes checked. The other rare thing that generally happens in younger patients is use of steroids. So sometimes it's the face creams or something. Sometimes these face creams themselves have a little steroid, which causes raised pressures and loss of vision. So we have to rule that out also.
Ma'am, but the entire world uses face creams. And
no, I am saying face creams with steroids.
All right. Face creams with steroids is something that one has to be careful about. You mentioned it before speaking, but despite that, there have been quite a few questions. So perhaps you can repeat that.
Of course,
what are the precautions that should be taken to avoid glaucoma? At least 3 people have asked this question.
One is regular eye test. Yearly eye test is something I stress upon because nobody knows when they get glaucoma, because early glaucoma is only detected when we examine. So when we check the raised pressures and there is optic nerve damage, that's how we correlate that the patient has glaucoma. So most of the patients who come for a regular eye checkup and I say, you have glaucoma, you need to use drops for the rest of your life, they look at me as though, what is this you're throwing on me? But then I have to educate them. They really don't know.
We have a question from Mr. Syed Rizwan Haider. This is in Hindi. I thought I would try and speak this in Hyderabadi Hindi, but I'll restrict it to the way he has said. मेरी वाइफ का दोनों आंखों का ऑपरेशन हो चुका है, लेंस भी लगा है, लेंस भी है, तो क्या इसमें कोई कौन सा आई ड्रॉप उसके यूज कर सकते हैं? I would, of course, even before you say this, I think these are questions that are best answered by doctors who actually, examine.
I try to answer in Hyderabadi Hindi.
Yeah, but go ahead, please answer the question. Yes.
Yeah, हमारा आंख जैसा है, कैमरा के जैसा है. आगे एक लेंस रहेगा, पीछे फिल्म. हम जो बदल रहे हैं अभी, एक लेंस जो बदला हुआ है, पीछे वो पर्दा है जो हम रेटिना बोलते हैं, उसमें कभी भी प्रॉब्लम आ सकता है या कभी कभी बैटरी में भी प्रॉब्लम आ सकता है. तो ऑपरेशन के बाद भी आपको ईयरली एक चेकअप कराना जरूरी है.
Right. Thank you. We have a question from Aarti Ghosh. She says, I have undergone hip replacement surgery on September 29th. Can I go for a cataract?
Yes, you can. That shouldn't be a problem at all, because hip replacement, cataract surgeries nowadays can be done with topical drops itself. There is absolutely no risk factor for even local infiltration and all. It's only you should be able to use the drops post cataract surgery.
Right. Doctor, I know the subject is glaucoma, but when you have a senior ophthalmologist in the house, so there are questions.
I'm a cataract surgeon too.
As well. I know, but the subject is glaucoma. But anyway, we have Mr. Lakshmi Narayan, and who will be soon will be 70. He says he's been to Netralaya and Prabhavision in Bangalore in 2023. One said little sign of cataract, and the other said please get the surgery done in the next 3 months. I have taken the option that was convenient to me. Just early this month, I again checked, and I've got some contrasting inputs with respect to the time for doing the surgery, while both have said it needs to be done. This is a bit confusing. Some say initial stage, there's no earth-shaking hurry to do, and one needs to wait for it to mature. Please advise.
Actually, let me start by explaining. The cataracts are divided into 5 grades. So, because nowadays the techniques have changed and we are doing through a small incision of 2 mm, I'll be using ultrasound energy to remove it. So, in case the cataract becomes very hard and dense, it goes above grade 3, then there is a possibility that I'll have to use high energies. And when I'm using the high energies, it's not safe for the eye. So up to grade 3, you can wait, but beyond that, it is always better to get it done.
Right. This is a question I'm sure you don't have an answer for, but this is from Sejal Harshvardhan Shah. She asks, why are glaucoma medicines so expensive? The drops.
Not all glaucoma drops are expensive. If you go with the patented ones and the generic ones, there's a lot of price variation. The way the generic ones work and the way the patented ones work are a little different, but then they give good effect.
Right. There's a question from Rita Bhasin who says, sometimes water comes out from my eyes. I want to know why that happens.
There are a lot of reasons for that. One, it could be because of irritation, because of allergies, or it could be because of we have a duct from which the water from the eye goes into the nose. So that also could be blocked. We don't know unless we examine you, we cannot say.
Right. This is a question from Mr. Raghu, who asks, is there any instrument to check oneself pressure? Like
Yes, we do
in
have.
diabetes?
We have what is known as a small tonopen instrument. It is like a pen, but you need a little local anesthetic to, put it on your eye and measure the pressures. That is one way. Then you have another instrument, which is a small device like a pin, which touches the cornea, and it is a handheld tonometer. That also can be used.
But obviously,
they're expensive again.
they're expensive, and would you advise that to be done by a common?
Yes, handheld tonometer is something that you can, hold it close to your face and do it. It is possible. It doesn't need any topical.
You said it needs a local anesthesia?
One is tonopen needs local anesthesia, but the handheld tonometer, it doesn't need any. This is the latest one.
All right. Doctor, there's a question which has come in from Bomi. I think that is Katie Dadanchi. Doctor, in one eye, when I close the other eye, the small print in the newspaper seems wavy. What is it due to? Is it due to the newspaper? Or
you have to get your eye examined. Mostly it could be because of an epiretinal membrane, or it's a very huge vitreous floater, or it is age-related macular degeneration. These are the three things. See, vitreous floater, I don't have to worry at all about it, but the other two have to be addressed.
Right. Doctor, I know a question like this puts you into a spot, but this is Mukta girl who asks, I checked my eyes by two doctors. They have a different opinion. One said cataract present, other said not. What was your advice?
Mostly it is not there.
All right. Anupama Singh asks, what are the chances of repeating cataract after a successful cataract operation? Could it recur?
It's not, I won't say it's a cataract. We put the lens over one transparent sheet. This sheet has a tendency to become white. If in a normal 100% patients, if I do, around 30% it becomes white. Younger the patient, the risk is more. So what we do is we clear this whiteness with a laser. That's what is known as an after cataract, and it is done only once in a lifetime. It is not repeated again and again.
Right. This is Shobha Srivastav. She says, I'm 73 and I have blurred vision. Could it be glaucoma?
Could be, couldn't be. There are a lot of reasons. That's why we say it's better to get an yearly eye checkup done. We don't know exactly because by just looking at the eye, we cannot say on the screen or video call or WhatsApp images. It's very tough.
Right. Vinny Gulati asks, can we have laser treatment at the age of 60?
For refractive correction or what? For what is it?
Not mentioned. Not mentioned.
If it is for refractive error, I won't advise at 70 because we have to address both.
60, sorry.
60. I won't advise laser surgery, refractive surgery for refractive corrections because it's going to just correct your distance vision and you will still need to wear your reading glasses. The better would be to go with cataract and get a multifocal done. That way you can totally get rid of your glasses.
Right. There's a question which says, Doctor, I find that the light levels in my room are not enough when I have to read a newspaper, but otherwise it's all fine. Could it be something that I need to get checked?
Yes. There are two reasons that clearly indicates that your contrast is reduced. Either it could be because of your cataracts, or it could be because of your changing number, or it could be also because of glaucoma, or also because there is some damage to the nerve, optic nerve.
Right.
So I would suggest it is a must.
There's a question which is from Shakhori Mithunjay Kumar. I have a slight black image moving with eye movement. I visited Arvind Eye in Pondicherry, and they say it is normal.
Yeah, that is known as a vitreous floater. Within the eyeball, we have a jelly, which is known as vitreous. So when we keep moving, these spots within the vitreous, they keep moving up and down. They generally occur because of aging. This vitreous collapses. So few opacities are formed.
Right.
Nothing to worry about them.
There's a question which is from Rita Basin. My younger sister's eyes, sometimes blood comes from her eyes. I want to know the reason, what she should do.
Blood as in, you mean to say a subconjunctival hemorrhage?
Well, she hasn't mentioned that, but she says...
If it is the white part of the eye getting red, that is known as subconjunctival hemorrhage. If it is recurrent, there are 3 or 4 reasons. One, you have to get your blood profile done, especially for clotting and bleeding. Sometimes if the patient is prone for bleeding and all that, they can get these subconjunctival hemorrhages. Or sometimes there is trauma, recurrent trauma, like they go on rubbing their eyes, whereby the small vessels in the eye, they burst. And the other one is vitamin C deficiency. So vitamin C supplements is a must.
Right. Doctor, this is a question perhaps you've been asked several times. Doctor, I can't get sleep without watching some movies in the night on OTT platforms. Is there something that I should be wearing, some special glasses so that I can avoid protect my eyes?
As such, nowadays, most of the screens, they come with the ARC coating. So what I suggest is if you can stop watching just before going to sleep, because it's known that any kind of stimulus to the eye post, 1 hour before sleep time, that doesn't give you the good NREM, that is non-rapid eye movement sleep. So it's always better that you're off screens 1 hour before you're going to bed. Try to read a book, try something else.
Yeah, this is another question asked by Mr. Lakshminaran. He asked, I just heard that one could do away with glasses, while my doctor said that the distance vision can be done without glasses, and they would insert a lens for me for that, and for reading glasses maybe needed. What should be the sugar levels during the surgery, he asks.
I would suggest for cataract surgery, you should have a sugar level fasting should be less than 150, and post lunch should be less than 190. Up to 200 is okay with me, but then each doctor varies. These are the cutoff points.
Right. Question from Veena Kurana. My age is 59. Is there any treatment to remove the specs?
Of course, we do have. But for each eye, it's different. What suits for you might not suit for somebody else. So unless and until we examine you, we talk to you and all, and what are your needs in the day, like what is the vision that you use maximum, is it for distance, intermediate, near, then we focus on those areas. Whether you drive a lot or you don't drive at all, we take all those into consideration. The lifestyle is very important before we decide on the lens.
Right. Doctor, there's a question which has come in, and I want to ask a supplementary question to that. This is from Sarita Agarwal, who says, I've got cataract surgery in one eye and I have no problem in vision. But the doctor says my second eye has got got cataract. Should I go in for a surgery? And my question is, from what the question that we received today, it appears that there are a lot of contrasting views that people get
Yes.
from doctors as well. So, how does a layperson know what to do? Because you're going to an ophthalmologist, you're not going to an optician, for an eye checkup. And when you get contrasting views, what should one do?
I would go to a doctor whom I trust, to be frank. So the thing is, each person is different. Few people operate a little early and few people operate a little later. But my view of looking at it is, what does the patient want? If the patient complains, yes, I have decreased vision, I'm not able to go around, then yes, I would do the cataract surgery. But a patient with an early cataract, no problem. They don't drive in the night. They're not experiencing any glare. Why remove an early cataract? You can wait.
Right. Doctor, there's a question which is there about exercise. People have said that exercises are not really important for the eyes. They don't really help. There are some people who say it is good to exercise. So what is what is it, really? Should you do those eye exercises like these, which are there, which one would see on
Yes, I
television?
would suggest go ahead, but then immediately after any eye surgery, depending upon the type of surgery, if a patient has undergone a normal cataract surgery, I would say better to give the eye a little rest for 15 days or 3 weeks, then go ahead with the exercises. Or if it is a kind of a squint surgery, then I would say it's 6 weeks. If the patient has gone and undergone a retina surgery, then I would say it's better you wait for 6 months.
Right. Doctor, there's a question. Is it harmful to have a lot of water early in the morning? Is it bad for the eyes?
There is a research thing that has been published that excessive water drinking can cause angle closure glaucoma, especially in patients who are prone for it. And it has been the cause for raised pressures. So if you are in the advanced or moderate glaucoma, I won't advise you can guzzle 2 liters of water at once. I would suggest have half a liter, wait for 1 or 2 hours, then have another half a liter, not 2 liters at one go.
Right. 2 more questions, doctor. We have Rani Shekhar, who says, मेरी both eyes का cataract का ऑपरेशन हो चुका है, पर तब से मुझे always अपनी eyes के अंदर चारों तरफ पानी वाटर दिखता है, इवन दिखने में भी ब्लर दिखता है. डॉक्टर कहते हैं कि कभी कभी ऐसा होता है, स्लोली हैबिट हो जाएगी. Is that?
Yeah, that could be because either it's a multifocal lens. Most of the multifocal lenses cause a little bit of glare and that watery vision, which eventually the patient will get used to. Or the other reason is sometimes, rarely, the retina nerve gets cystoid macular edema, which can cause this kind of the watery vision. So examination of the fundus is also required. So एक टेस्ट तो कराना पड़ेगा माँ पूरा dilate करके.
Right. The question is splashing eyes bad?
Depends on the water. If it's clean
so
water,
what kind of water should one have?
filtered water. Sometimes if it's a young kid and he has allergies, what we call as vernal keratoconjunctivitis, they're allergic to dust. So I tell, as soon as a kid comes from back home, just splash the eyes with cold water from the fridge. So at least I know it's clean water.
Talking of water, Rita Vasina says, please tell me, what should I do when water comes?
First, we need to know why it is coming. Then we can stop it. It's like I can temporarily say use refresh tears, eye drops, but then I should exactly know why it's happening. Then I can treat the cause.
Doctor, that's one last question, and I think it's
definitely,
which is from Rekha Goyal. She asks, मेरा नंबर 25 सालों से वही है, क्या चश्मा उतर भी सकता है? प्लीज बताएं.
Yes, definitely चश्मा भी उतर सकता है कभी कभी थोड़ा कैटरैक्ट बढ़ने से. So कभी कभी वो मोतीबिंद गट हो गया तो सेंटर में थोड़ा नंबर का चेंजेस 0 भी हो सकता है.
Right. Doctor, tell me, what do you do for your eyes? You obviously are, over the last few days, we've been trying to reach you, and you are in the OPD, so you obviously have a fairly busy schedule, and being in a leading hospital in Hyderabad. How do you take care of your eyes on a day-to-day basis?
Regular eye checkups with my colleagues.
Regular eye checkups. So how often do you take?
Yearly once.
Yearly eye checkups, and this is from
Maxivision Eye Hospitals. We are a group of hospitals.
Right.
So.
But a lot of people also go to opticians and,
No, I want advice, especially if you want to get a full examination done. If you're just going for glass change, yes. That is why I mentioned in my talk too, that if you want your glaucoma to be detected early, you have to get your eyes examined by an ophthalmologist and not an optometrist, because the optometrist is just going to check your eye pressures and glasses. That's it.
Right. Thank you very much, Dr. Anitha Kamarthy, for this session. And thank you to Maxivision for facilitating this. And to all of you here, we will be back once again with another session of Health Live at Seniors Today. That is next Saturday at 5 p.m. But before all of you go, and before I would also request Dr. Anitha to stay on. Our producer will play a short video of the latest issue of Seniors Today. It has something that the entire world is talking about, and we couldn't run away from that topic. So I can't see the video. So that's the latest issue of Seniors Today. It's available on the website at no cost. You can just go there and read as much as possible. We have two interesting articles. One from somebody, our writer from the US has written, one from a publisher here from India. And we also have, just as a side element, Hollywood movies which have had the president as a character in the movie. So interesting mix of content. I'm sure all of you will enjoy it. I will also send you a copy, Dr. Kamarthy, for your perusal.
And I thank all of you. It's been amazing. And
we've had, Doctor, I was just looking at it, as we have had 995. I just saw people watching it on YouTube. So all of you watching on YouTube, please come on the Zoom. You can also ask doctors like Dr. Anitha Kamarthy, questions live, and you can get them addressed here. So, but yeah, thank you very much.
Thank you.
What we will do is we will take the presentation from you, from your office, and when we put up the edited video as well as the takeaways, which are written by a qualified medical practitioner who works with the Indian Army, and so she writes the takeaways from each session, just capturing the essence of each session by doctors whom we have. So that will be up on our site on Monday evening, and we will also carry the presentation with that. Thank you very much.
Thank you. It's been a pleasure.
Thank you.
Subscribe now and press the bell icon. Never miss an update.